Well, now to a Channel 5 special report, treating the Valley's most critical COVID-19 patients. According to state reports, only 9 ICU beds are available in the Valley, with a population of over 1.3 million people. Our Ismar Ventura takes us inside an ICU for a look at the COVID battles that are playing out.
That's right. Channel 5 News was the only local news organization to have access to the intensive care unit at the Harlingen Medical Center and see firsthand how it looks from the inside. Doctors say that COVID-19 hospitalizations can get out of control unless everyone does their part in preventing this deadly disease. The sounds inside the intensive care unit at the Harlingen Medical Center, a reminder that the pandemic is far from over. Here, the critically ill are treated day and night.
Uniquely, patients that have not been vaccinated. This is very sad because this is a preventable disease now with the vaccines available.
Vaccine that most of the hospitalized today opted not to receive.
Right now, with the variants that are coming out, there's still, the data is showing that the vaccine is still effective at least preventing patients from becoming very, very sick and or dying from these other variants. It's the younger age group now with the lower percentage of vaccination that we're seeing more of the positive, positive COVID cases.
Matt Wolduff is the executive director at Harlingen Medical Center. He says although the rooms are not as full as they were a few months ago, we are not far from repeating those scenes, especially with those who refuse to get vaccinated.
We don't have the same number of resources that we had several months ago, and so we've got to be even more diligent to make sure that we don't have another surge. And so that's, again, why vaccination is so important.
The hospital has 112 beds, 16 located in women's services, just 11 more than in August 2020, when 85 of them were occupied by patients with COVID-19 in critical condition.
Hello.
Since then, the phone hasn't stopped ringing.
But
I didn't imagine how bad it was going to be or how much it was going to develop. This floor was totally COVID. We had patients who came in with heart attacks or another emergencies, and we placed them in another area with the nurses. But this floor was full of patients with COVID.
The emotional price these nurses have had to endure has been greater than even they could imagine.
Seeing people die more than the usual. We did wear these masks, like I was telling you, not only these, but we also wear our N95s along with this mask. So we were wearing them sometimes more than 12 hours.
And now we're in the intensive care unit area of the medical center here on the second floor, and we're about to see how the COVID-19 patients are doing inside their rooms. Before we could enter and see for ourselves what's behind these doors, we had to put on special protective equipment. Now we're able to see pretty much what we expected. People connected to respirators and medical machinery that detects each patient's heartbeat.
We're seeing a number of patients that is to me tragic, because a lot of these patients that are coming in very, very ill and requiring critical care.
Even so, doctors remain optimistic in the midst of the uncertainty, emphasizing that we should be mindful of our loved ones and others. Tomorrow, in the second part of this special report, we share the story of a couple that was hospitalized for weeks at the Harlingen Medical Center. They tell us how hard it was to get through one of the most difficult moments in their lives. Ismar Ventura, Channel 5 News.